Sorry about this glare in my glasses. I don't want to put my contacts in, but though I feel like I can't see through it, or you guys can't see me. We will get through it together. I keep my head down. Hi, baby.
Oh, I thought you were recording.
I am recording.
Sorry.
It's okay. You going to bed? All right, I love you. That's my son. Okay, so today's topic is going to be sulfonamides or sulfa drugs for Pharmacology Friday for nurses. So to reiterate for antibiotics, there's a couple of things that are really important to know. One, you do not drink alcohol when you are taking an antibiotic. Two, it can interfere with your contraceptive or your form of birth control, so make sure you have a backup plan just in case. Three, you want to make sure that you are taking the entire course of the antibiotic, because the antibiotic can kill off the good or the normal flora in your system, allowing the other bacteria that is resistant to that drug to overgrow and overpopulate, which can be very harmful to you. We have a couple like C. diff and MRSA that are huge that we want to try and avoid, and those are considered super infections or super bugs. So some examples of sulfa drugs are sulfasalazine, sulfamethoxyl. Sulfa drugs work by interfering with the folic acid synthesis in the bacteria. There's actually a quite extensive list of uses for sulfa drugs. A couple include Crohn's disease, ulcerative colitis, UTIs, malaria, and certain skin infections. Some side effects are nausea and vomiting, which are common, diarrhea, which is also common, candidiasis or thrush, dizziness, fatigue, headache, and itchy skin. So the thing about the diarrhea is that it can cause bloody diarrhea, so don't forget that. And it can also cause your urine to be like a yellow-orange tint. Sulfa drugs can also cause a rash that is called Stevens-Johnson syndrome. This is huge. It's potentially fatal. Symptoms include sheets of skin, detachment, exposing red, oozy skin underneath. Is horrible. It can also cause anemia, leukopenia, and other hematological side effects. Sulfa drugs are actually pretty heavy duty. It's pretty common, at least I have seen in patients' charts, for them to have a sulfa drug allergy, and you really need to pay attention to that. Contraindications. So sulfa drugs, again, if they have a hypersensitivity or if they have an allergy to sulfa drugs, you're obviously not going to give them any kind of sulfa drug. And pregnancy. So sulfa drugs are considered a category D drug for pregnancies. So you really do want to try and avoid them. You are going to give them lots of water. You're going to monitor their CBC, or their complete blood count, and you want to weigh the patients daily. And NCLEX loves to ask about the Stevens-Johnson syndrome. There are a handful of drugs out there that do cause this phenomenon, and sulfa drugs, sulfonamides, are one of them. So a mnemonic way to remember sulfa drugs is by knowing the acronym SULFA. S is for Stevens-Johnson syndrome, that rash. U, urticaria or urine precipitation. L, leukopenia. F, folic acid deficiency. And A, aplastic anemia. All right, so that was sulfonamides or sulfa drugs for our Pharmacology Friday for nurses. I'm going to be sticking to the classification of antibiotics for a while. They're pretty extensive, they're very important, and you'll basically see them in any kind of specialty that you work in. So if you like this video, you want to see more, or you have an idea for me, please like and subscribe, and comment down below letting me know what other drugs you would like to cover, if you have any questions, or if you found this video helpful, or if I missed anything, because I'm learning too, and we can all learn together. All right, thanks guys, bye.